So why is it important to have your MS treated? Well, we do know that MS is a bad disease. So if you leave yourself untreated, we know what the average natural history is, and it's very poor. So people who lived in the what we call disease-modifying therapy era and were left to the natural history of the disease, the majority of those people, given sufficient time, ended up with fixed and permanent disabilities. And what I'm talking about is requiring walking aids, wheelchairs, bladder bowel dysfunction.
Right, so Tysabri is one of the drugs that we use to treat multiple sclerosis. It seems to be more effective than some of the first-line drugs that we would use. It's been very widely used around the world with over 100,000 people on it now. So Tysabri isn't a tablet, it's given by an infusion, which means it's given by a drip. It's given once every 4 weeks. It takes about an hour to go through with an hour observation afterwards. So Tysabri is an antibody treatment. It was specially designed to do the job that it's meant to do. When we see people with MS having attacks, what seems to happen is that white blood cells, which are cells of the immune system, leave the blood circulation and go into the brain where they cause some damage. To leave the circulation, they have to stick to the wall of the blood vessel, and Tysabri is an antibody which is targeted at the surface of those blood cells, which stops it sticking, and if they can't stick, they can't get into the brain, and if they can't get into the brain, they can't do any damage.
The idea is, I've got active MS, I'm having frequent relapses, I'm not recovering from my relapses, I may be finding that the poor recovery is causing disabilities. For example, I'm having difficulty walking, or I've got bladder or bowel involvement. So the idea then of the treatment is to stop having all activities, to stop you having relapses, switch off the new lesions on MRI scan, and allow people to recover.
So Tysabri isn't a treatment for everyone with MS. It's only for people with relapsing and remitting disease, and it's usually used for people who either come with unusually aggressive disease, so lots of relapses at the time that they first come with MS, or for people who have been on one of the interferons or Copaxone and aren't seeing a good enough response. So there's been a big trial program done looking at Tysabri, comparing it to placebo, and also since the drug has been launched, there's been careful follow-up studies of how it behaves in the real world. So we know, compared to placebo or dummy drug, if we put people on Tysabri, that we see 80% less relapses in people with highly active disease. So if you qualify for the drug and we put you on it, we really do expect the relapse rate to be significantly better than if you weren't treated. When we look at this outside the study populations, just in people who are on the drug in the real world, there's been thousands of these followed up, and we see a very good ongoing low relapse rate, coming out round about 1 relapse every 5 years on average.
Sometimes it's quite difficult as a concept to get across what is disability. But in clinical trials, what we define that as people who are on the dummy drug placebo, for example, get monitored using a disability scale. And one of the outcomes we look at is time to using a walking stick, for example. So people on dummy drug are much more likely to need a walking stick than people who take Tysabri. So what we say by disability progression is, or preventing disability progression, is that if you're on Tysabri, okay, your chances of needing walking aids or reaching a particular endpoint is much, much lower than if you're on dummy drug placebo.
Quality of life is different from the kind of things doctors would look at. So we sometimes look at things very black and white from our point of view, and what you can and can't do when we examine you. Quality of life is looking at how people feel on the drug. And when we ask people who are on natalizumab questions about how well they feel in themselves, how well they feel mentally, how well they feel physically, we see that people on natalizumab, Tysabri, tend to feel better and believe that their quality of life is better than people who weren't treated with it. When we're following someone with Tysabri, it's a drug where you're coming in every 4 weeks to get the drip, and we check on people as they come through. That's part of us monitoring the safety of the drug and how well it's working. And at least every year we'd expect people on the drug to be seeing their doctor. We tend to repeat the scans both for safety and to check how the drug is working. And we ask you how you're doing. So the easiest thing to see is whether people are having attacks. We don't really expect frequent attacks on the drug. So we'll be asking you if you're having those. People on the drug, when you're up seeing the nurses to get the drip, will be able to tell the nurses how things are going.
Everybody responds differently to treatment. Now, although Tysabri is a very effective drug on average, not everybody is going to respond to the drug. There are some people who fail on the drug, and there are reasons why some people fail. The drug acts like a vaccine in a small number of people, about 1 in 20, and it causes your own immune system to make antibodies. These are the proteins the immune system makes to fight infections, and in this case they are made against the drug, and they stop the drug working. We call those neutralizing antibodies. So in 1 in 20 people, the antibodies stop the drug working, and that's one reason why the drug may fail. Another reason is maybe the biology of the drug, the way it works in certain people, is different. So the effectiveness of the therapy on average is very good, and in highly active patients it reduces the attack rate by over 80%. But there's still a small number of people who go onto the drug that continue to have attacks.
It can sometimes be difficult to decide how quickly you expect the drug to work for different people, because we're sometimes looking for slightly different things. So if you've had very frequent relapses and go on to Tysabri, we will know within a couple of months whether we see that relapse rate go down. If the relapses are less frequent, maybe it's going to take up to a year before you get a feel if you're doing better on the drug than off it. And some people, however, they do start to feel better not long after they've been on the drug, and we can see those measures of quality of life improve over the first 3 to 6 months. In terms of side effects, Tysabri generally tends to be very well tolerated. For most people, we see very few problems with the infusions before, during or after. Some people do get reactions to it, particularly during the first couple of infusions. We worry some people become allergic to the drug, so you'll find that you tend to be watched a bit more closely for your first 3 drips than you do after that. Some people feel a little odd after it, but generally it goes in very easily, and that hasn't been a problem in our experience.